Hi, my name is Diana Karamakoska, and in this video, we will be looking at interviewing techniques. There are a few key steps to a successful interview. These range from putting people at ease, smiling, and appearing warm, caring, genuine, and professional to your clients or patients, speaking clearly and slowly in a calm manner, being able to introduce yourself and your role on the first visit so that they are aware of what you will be doing for them, and using positive, non-verbal and verbal communication techniques. It's important that when you sit down with your client or patient that you listen attentively to what they are telling you. Sometimes people can allude to other information that may be essential for you to know. This may be because they are afraid of disclosing something to you, or that the therapeutic relationship has not been established yet. Your client needs to feel as though they can be honest and open without you, without feeling as though they're going to be judged. When this happens, the interviewer needs to probe gently and paraphrase what the client is telling them. Paraphrasing is critical to ensure you understand what the person has told you and you have the correct information from them. It also gives them the opportunity to rephrase or re-clarify any information that you have paraphrased incorrectly or misinterpreted. Now, when we look at probing, we're asking our clients or patients for more information about something they mentioned, which may be important to the client's treatment, their case history, or their health story. Probing should be sensitive. You can ask something along the lines of, "Do you mind me asking more about?" Probing should also be phrased carefully, so you could easily ask the patient to explain something to you. It must also be relevant to the case history or the treatment of the client, and it's not intrusive into the personal life of the client. It's also accompanied by appropriate body language. You need to maintain an open posture, reduce facial expressions to a minimum so as not to act surprised or concerned or overly concerned about an issue, and also accompany this language with appropriate head movements, so things like nodding every now and again. When we're paraphrasing, we're repeating back to the client what they have told you. It needs to be in your own words, a summary of that information, and paraphrasing ensures the information that you have collected is accurate, comprehensive, and that you understand the client. When it comes to sensitive questioning, some issues are more likely than others to cause distress. You must be ethical in your approach to these issues. Consider the level of rapport and trust you have with the client. Is this your first interview with them, or have you been seeing them for a while now and can approach them about these issues? Is your therapeutic relationship strong, or do you feel like it's becoming strained? You must also respect your client's wishes not to discuss some matters at a particular time. This may not be indicative of a breakdown in your therapeutic relationship. It just might say that the client is not ready to talk about some things yet. The opportunity to tell a story or provide an account must be given to them from a non-judgmental listener. And it's your job as a health professional to maintain that non-judgmental look. You must also consider validation and reflection when you are speaking with your client, and the therapeutic benefits of talking about something. So try to highlight that to your client when you do sit down and you are talking about something sensitive. Validation is also another important interviewing technique. It is built on an empathetic attitude and a holistic view of individuals. It is when one can step into the shoes of another human being and see through their eyes, and one can step into the world of that person and understand the meaning of their behaviour. The acknowledgement that everyone has a right to speak and be heard is an important factor when validating somebody's feelings. And we come back to the idea of reflection. This is when we reflect the story back to the client or the patient or the interviewee. And this can be in the form of a self-reflection following the interview as well. You can ask yourself questions about whether you did that well, how you could have done it differently, and what you would have done differently next time. These types of questions and self-reflection will ultimately enable you to improve on your skills at interviews and communication so that your development as a health professional is always continuing and striving to be the best that you can be.